course, Internet Use in India, Myths, Realities, and Health Risks, organized by the CHIP Foundation in association with Eco India. It is truly heartening to see such a committed gathering of professionals, educators, students, and public health advocates coming together to address a topic that often goes unnoticed but has profound implications on public health in India. Areca nut use, commonly known as supari or betel nut, is deeply rooted in cultural traditions and social customs across various parts of our country. However, what often remains under-acknowledged is its classification as a Group 1 carcinogen by the World Health Organization and its strong association with severe health consequences, including oral cancers and other chronic conditions. This course seeks to unpack these deeply ingrained myths and shed light on the scientific realities surrounding areca nut consumption. Over the course of our discussions, we will explore the historical, cultural, and economic aspects of areca nut use, its health implications, and the policy and regulatory framework that govern it. Most importantly, we will consider how community level interventions and awareness campaigns can be leveraged to reduce its harmful impact. Thank you for being with us today, and I look forward to an engaging, thought provoking, and solution oriented session with all of you. Now, I request Dr. Shekhar sir to kindly proceed with the panel discussion.
Thank you, Sakshi, for giving such a warm welcome to the participants, and we are happy to see everybody here again for this common cause. Well, areca nut is something which is not talked much, but it is a grave problem which is of public health significance, and we have distinguished experts here today with us to discuss about it more. And we heartily welcome Professor Dr. Sunilagar ma'am. Ma'am is a pioneering figure in tobacco control and public health in India. Ma'am has professional research experience of over 4 decades. Well, ma'am, we are all very eager to learn from you on this topic. Currently, ma'am is the Professor of Excellence, Chair Program Advisory Committee at the National Institute of Health and Family Welfare. She is the member of Department of Health Research. She is the ex-sub-dean and head of community medicine at the prestigious Maulana Azad Medical College and head at the Faculty of Management Studies, Delhi University. She was the national president of IAPSM, which is the National Body for Preventive and Social Medicine, and the national president of OMAG 2021 to 2022. She was ranked amongst top 2% scientists database by Elsevier. She has been as advisor to ICMR, member task force Department of Biotechnology, member of Lancet Commission, alumni of London School of Hygiene and Tropical Medicine. She has been awarded with K.N. Rao Memorial Oration in 2018. She has been awarded with Harcharan Oration of IAPSM for the year 2019. Ma'am has published over 225 papers and has nearly 250 media talks and press briefs on various topics of health importance. So with this such an enriched and deep-rooted background, we hereby welcome our own Professor Dr. Sunilagar ma'am on this platform.
Thank you. Thank you, Dr. Shekhar, and good afternoon to everyone.
Thank you, ma'am, for giving us your time. We also have another expert speaker who will be joining us in very shortly in a few minutes. And his name is Dr. Ravi Kaushik. He's a professor of physiology at the Maulana Azad Medical College and Associate Hospitals. He is MBBS and MD in physiology from UCMS, Delhi University. Also PG Diploma in Geriatric Medicine and an executive program in management from Wharton Business School, USA. He has over 16 years of experience in medicine, teaching, research, and management. He is a National Institute of Health Research UK Fellow and has experience of handling clinical research projects related to public health, cancer prevention, oncology, cardiovascular diseases, pulmonology, tobacco control, and epidemiology. He was also a past scientist C at National Institute of Cancer Prevention and Research. So we will welcome him very shortly. And here we are with our own our second session for this under this topic of areca nut. And ma'am, before we start, ma'am, would you like to speak any opening remarks about this problem, grave problem in India?
Thank you, Dr. Shekhar, Anshika, Dr. Sakshi. I can see everyone, people from Chip Foundation, and all my dear colleagues who are present over here virtually. I think it's a great job to talk about Areca nut because we have not been, kind of discussing much about this, but there is huge consumption, and this is, I'll say, a kind of a hidden agenda. We used to commonly call it as supari or something like, it's a brown colored oval nut, but this is so widely available. Yesterday evening, I think when I was discussing with all of you, I realized, and I went down the memory lane exactly to my earlier younger days when in the family also people used to consume areca nut along with lime and and we never knew that this is going to be so very dangerous. But as the years have passed by and we do have data which is emerging from national health surveys, something like global adult tobacco survey and all, that we realize that the consumption is approximately 14.6% of our adults, and I'm not talking of adults who are 21 years and all, they are above 15 years. But my own experience, with the last, ESTA survey addressing smokeless tobacco in Asia, we realized that our teens, who are, and earlier than that, the children who are in fifth class and above, they are also consuming areca nut, thinking that it is something so very normal. And it is because they have seen their families consuming areca nut. That is also important. And also it is so very casual conversation within the family that the father will say to the son, or a brother will say to the, younger child, go and get this, that is important. And somewhere when we say that, under the framework convention of tobacco control, that we need to prohibit sales to minor by minor any tobacco related product, and which is also, we see that areca nut is one of the important products which is consumed along with tobacco most of the time. So it is so harmful if we see something which is consumed from pediatrics, and if it goes on to geriatrics, we have huge, I'll say, implications. It's a carcinogenic agent with lot many side effects. So that part is very important. But coming to the further part of it, because we are today 146 crores, it's a huge number one in the world when we talk of. And, when we talk of that, the use is more common in males. That means when we are talking of 22% males and 7% females. Here also, I like to comment upon that when we talk about males and females, let me tell you, a lot of data is underreported. Quite a number of times, reporting also does not take place because it is something which our females think that it is something very normal. Isko batana kya? So that is where we need to be very much particular when we do this survey, elicit the data, and especially there are certain areas when we do any survey, tobacco related survey or, non-communicable diseases survey, our ashas are filling CBAC form, that is communication behavior assessment checklist with regard to risk factors, and we are talking of risk factors with regard to non-communicable diseases. And one of the important risk factors is that we have to address tobacco products, but along with that, they have to talk about areca nut also. So because then only we will get correct data, because as of now, our ASHA workers, or 3As, what we call them as ASHAs, Anganwadi workers, ANMs, they are based in Ayushman Arogya Mandirs, and ASHAs and Anganwadi workers are looking after 1,000 population. So if they also elicit the data in the 1,000 population, how many males, how many females, how many children are consuming this, because sometimes our data or our national surveys are also not still reflecting the true picture, though we say that they are representative of the population, but it is very important to elicit data about this whole issue. That is very important. And again, I said we are 146 crore people divided over 36 states and union territories. So also yesterday, when we were discussing about this topic, I realized that, we talk about northeastern states and all that. But you see, if you look at a big state like Uttar Pradesh, which is so huge, with so many districts, and taking areca nut along with betel is so very common. So that is where we need to also focus upon this. But along with that, we do have states like Kerala, Karnataka, Odisha, where, we can have the, targeted interventions, which are need-based interventions, which are specific interventions, so that, interventions in the sense we need to focus upon IEC, information, education, and communication. That means we inform people, we educate them, and we communicate them in the language which they understand. So these interventions should not be one-time intervention. We have to find out that, because we have got 12 task forces at Ayushman Arogya Mandir, which we earlier used to call it a sub-center, and some of our primary health centers also have been converted into Ayushman Arogya Mandirs. So there, regularly during when they come for NCDs and all that, because we have, as part of our ICMR project, we are focusing a lot on implementation research. That means, and one of the research is merging mental health with the non-communicable diseases. So especially when we talk of non-communicable diseases, their assessment and all that, this is the talking point where our workers should be talking. But again, let me tell you, this is not only a government business. We cannot manage the whole thing, separately unless we have partnership together. We have to talk of private-public partnership. So at each level, we should be talking about, that means our messages in both government and private sector, and each one of us. You see, that is where we are all, bearers or torch bearers of change. So it is very important that at every level we talk about, different tobacco products, but also now with a special focus on Areca nut, which has got huge, huge implications. And the public has to understand it is not simple supari that they just keep it in the mouth and they keep on chewing for a longer time. So Areca nut is something which has been brought into attention since, I'll say last few years, but it has got huge implications. So thank you so much for asking this question. But I'm very happy that exactly, and Dr. Ravi is also here. He will throw some more light on this area. And it's pleasure to be with Dr. Ravi, because we have been colleagues at Maulana Azad Medical College, along with Shekhar also coming from, MAIDS institution. So I feel that it is so very, I say heartening to see that we are talking at a common platform on an issue which is of public health importance. Thank you so much. Thank you.
Thank you, ma'am. Such great opening remarks, and you said it very rightly that most adverse habits are grossly underreported in all of our national health service. And Areca nut is something which is culturally ingrained, so not many people would understand the complexity of this product. And we are also happy to have Dr. Ravi Kaushik, a good friend of mine, over here in this panel. Hi, good afternoon, Dr. Ravi.
Hi, good afternoon, Dr. Shekhar.
I'm
Good
sorry we
afternoon.
started without you.
Hello,
So-
sir.
Anji, hi, good afternoon.
Good afternoon, sir. Ma'am, good afternoon.
Good
Wonderful
afternoon.
opening remarks, ma'am. Wonderful.
Sorry, I could not attend on time. SR interviews were going on, so was involved in that. Just got free from there.
No. It's okay. But it's very important that you are there with us. Yeah.
So
Thank you.
I'll take this forward. I would like to ask my first question from Dr. Ravi Kaushik. Dr. Ravi Kaushik, since you are an epidemiological expert, from this epidemiological perspective, what do you think that is there a similarity
For the other part of the world, the data is fragmented, and as the data which has come up, it's hardly okay. So it's hardly there. The only population which is consuming it there is the one which belong to this area and have migrated to these Western world or other countries, basically. So it's mainly the South and South Asian population which is consuming it. India perhaps remains the largest producer as well as the consumer of Areca nut. And from India and from some of the other Southeast Asian countries like Taiwan, Papua New Guinea, there are significant health impact reports which are there, including oral cancers, oral submucous fibrosis, which is there. And however, the other countries, if we talk of India, there is no such regulation as such, which is directly prohibiting Areca nut consumption, because as ma'am was also pointing it out, and you in your remarks also said that we have social and religious angle also ingrained within consumption of Areca nut. So, however, in some of the other countries, like for example, Taiwan, for example, there is this public health response, which include licensing the vendors which are selling the Areca nut. There are warning signages just like tobacco on the Areca nut products also, and there are some cessation programs also initiated there. So, herein we need to have multi-pronged approach where not just the public health professionals, the agriculture, the food processing industry, the basic education, right from beginning from what do you call it, the primary education, I would say. You need to have a multi-layer approach, multi-pronged approach to actually limit the consumption of Areca nut. So there have been examples wherein the progress has already been started. But in India, we are taking very infant steps till now.
Thank you, Dr. Kaushik. Beautiful examples from other countries. In fact, other countries, that means they have identified this as a problem and have started working towards it. Ma'am, over to you. My question over to you, ma'am. Talking about the hard-hitting facts in India, what are the exact consumption trends in India, and what does national survey like Global Adult Tobacco Survey they reveal about its prevalence? Maybe by
basically, I talked earlier also that we do have GAT survey which talked about that, approximately 14.6% of our adults are taking, that means 15 years and above. But I said this is still an underestimate, because when it comes to schools and all that, we do not, kind of focus on this attention. So this is where we need to talk on Areca nut in particular. That is one thing. And so it's a huge burden. And we were talking about males and females also. When we talked about males 22% and females about 7% or something like that. So I feel that, we need to still, that is where I started talking about the data from, each unit where we have a catchment area defined, like Ayushman Arogya Mandir, where 1,000 population is well under control of our frontline workers. So the burden is huge, but then there is a kind of thing that we need to have the district level data, where specifically we are going to focus upon, Areca nut consumption. Along with we are focusing upon tobacco, but we need to focus upon Areca nut in particular. But another thing I will like to tell you, for all these surveys, we need not depend upon Ministry of Health and Family Welfare. It is, a kind of, I'll say that, interministerial business, something like, we don't say that it's only health problems, so Ministry of Health is going to take care, or, we have to look at a huge education department, which is, both from the private and public sector, they've got an important role to play. So if we look at from that perspective, that is another area which we need to kind of focus upon. Again, Ministry of Agriculture and, education and food processing, all these have important role to play. So we need to have much more hard-hitting data. The second part is that whenever we are talking about, Dr. Ravi is there now in medical institution. So when we talk about our, postgraduates and all that, this should be one of our important topics of research, because when we got ESTA project in India, I remember, and I gave to one of my PJs. So one day he calls me up and he says, Madam, media people are asking, do children, in fourth or fifth standard, they take smokeless tobacco? I said, that's a hard-hitting fact which has emerged from your research. So that is where, I think around 3 or 4 times, when we went into the depth of it, it was really a hard-hitting fact that we do have a huge burden of the disease. But also, I will say that, it is something which is so much culturally and socially acceptable within our this thing. So still, one will say that, how many people are attending the weddings and all that, or, they are attending some ritual festivals, or, they're going to some parties and all that, or some tradition practices. We see that, this is something so very common and it goes unnoticed. That is where if they have gone, let's say once a month or something like that, it's not that, we have to say that the every day, every use, the quantum of dose also matters. But it is so very important that when we are going to perceive it as a problem, we will perceive it as a problem and we will say any wedding, any traditional function, any hospitality should not be, kind of even putting areca nut, along with beetroot. So that part is very, very important. So we need to look at that part. Another thing is that we will say that, also it should not be taken as something which is a stimulant anybody can take up for waking purposes along with tea, coffee and all that. No, this is something where we talk about, our health products and all that. So this issue becomes very important, and this also makes the individuals, not only biologically vulnerable, but also culturally vulnerable also. So that part becomes very important, and it also, kind of complicates our regulatory issues. So that is where, when we talk about different control strategies, this becomes very, very important. But as far as I'll say that the whatever estimates are there, I will still say that they are underestimates. We do have, data under CAT survey and all that, and youth tobacco survey also. So we need to look at the burden as a whole, which is big and which is very, and it will vary from state to state in Indian context when I talked about 36 states and all that. So I feel that this is high time when we have started talking of areca nut in particular. When we talk about tobacco control, this should or this should find a central place for addressal. Thank you so much. Thank you.
Thank you, ma'am. Thank you for your answer. I have another question for Dr. Ravi Kaushik. Dr. Ravi, please tell me, since ma'am is highlighting regarding the increasing aspect of increasing consumption of areca nut, maybe due to cultural effects or maybe due to commercial preparations, how does marketing and accessibility these affect the consumption patterns? And since the marketing is targeted mostly towards youth, so how does this marketing area affects the youth and urbans to taking up areca nut habit? We all see that Ajay Devgan and Shah Rukh Khan in that pan masala ads. So this is what I'm asking you about.
Right. In fact, if we talk of pan masala and flavored supari, marketing in last 10 years have played a very big role in, you know, reaching out to the population, which hitherto was kind of unknown. So these days, every kid, every adolescent knows about such products flavored. They start with elaichi, flavored elaichi, then they talk about pan masala, flavored supari, and whatnot. So such marketing has already been done since last 10-15 years at a very, very rampant pace. And even the sachets which are there, they are pretty colorful, attractive, and they are very important. They are priced very, very low. So anything ranging from 1 rupees to 5 rupees, the packets start, the sachets start, thus making them very, very accessible to adolescents, even younger children. So in some of the studies, we have found that children of the age of like 5 to 8 years also, they have accessibility to these things. Urban youth, especially if we talk, especially from the lower socioeconomic strata, the slum communities, they also view this as cool alternatives because their idols, for example, Shah Rukh Khan and others, which you are talking of naming them, they think that actually they are consuming these products and therefore they are cool. So they themselves try to use them and be cool. Smoking, thankfully, has significantly reduced in the society, and thus to have cooler alternatives, they end up consuming these sachets of pan masala, flavored supari, and even smokeless tobacco, and because they are celebrity endorsed. Social media, it's very important to have a notice of social media and also mobile advertising which is happening and is largely unregulated. That again is creating an environment which is normalizing the consumption of pan masala and supari, flavored supari especially. So for to combat all this, we need to have comprehensive restrictions on the marketing. Very important is age restriction, which we are trying to follow, but largely have not been able to. And even for the pan masala supari packets, sachets, we need to have health warnings. And we need to create more children and adolescent people who are actually marketing against these. So that again can be one of the important things by which we can combat this marketing strategies being played by big players, big and small players alike. There are so many brands which are there. Some are big players, some are new upcoming players, which have started making money and are doing very, very good business.
All right. Thank you, Dr. Ravi Kaushik. My next question is to ma'am, Srinagar ma'am. Ma'am, uh, we are talking a lot about moving towards community-based interventions and making the people aware. So apart from just a religious and socio-cultural acceptance, there are certain myths as well surrounding areca nut use. It is good for digestion, it is natural, or it is safe, it is God's gift, things like that. There are certain myths around areca nut. So how can we address these myths, and this won't this become a challenge when we talk about controlling this product?
I think Dr. Shekhar, you asked a very critical question, because I think a few years back, I was walking outside my, house, and I realized that there was a vegetable and fruit vendor. She was sitting there, and she took out something from her sari pallu and started chewing it. And I asked her, she said, "Ye supari hai and ye masala bhi hai saath mein." मैंने कहा, "आप क्यों खाते हैं? Why do you have this?" So she told me कि मैडम जी, आपको पता नहीं इसको खाने से कितना मेरे को राहत मिलती है, कितना मेरा खाना अच्छे से डाइजेस्ट हो जाता है, एंड देन इट हेल्प्स नॉट ओनली इन डाइजेशन बट ऑल्सो देर इज कॉमन प्रॉब्लम known as so people also correlate with that part, so that part becomes very, very crucial. That सबसे पहले तो ये जरूरी है that at each level, this is together we are talking about, but at each level, because people have different perceptions. So I feel that we must have an in-depth qualitative study. People take that, क्या उनको बच्चों को किक मिलता है, it is a stimulant, or for elder people it helps in digestion. So that part becomes very, very important. So that is where our innovative materials of education are going to play an important role only when they are culturally specific and they are state specific. Because if I was to talk about North India, the strategies which will work over here may not necessarily work in southern part of the country. So we need to look at that, and we need to also see at what time of the day do they consume, or continuously they are consuming, and how whether we talked about like when Dr. Ravi talked about 1 or 2 rupees and all that, I feel that 1 or 2 rupees karte karte pura din mein how much they are spending on this whole thing. So that means, even if they have some problem with regard to swallowing or some mucus fibrosis and all, their healthcare seeking also becomes, very poor because you see, where they are, when we talk about lower socioeconomic status and the vulnerabilities, but today, everyone, India is larger, I'll say largest, kind of with 146 crore population. I'll say they own smartphones. So that is where we have to see that, more than information, it is doing quite a bit of damage also, So our youngsters, they go to these sites and that's where, and they go to different OTT platforms also. And we say that every time, I think any movie you say, and there is going to be a line like, tobacco is injurious to health. So similarly, when we start seeing that pan masala or something like that, we need to kind of focus, not only focus, rather our, I have not seen any, basically a kind of a small film which is going to talk, or a 30-second slot, which is going to talk about the ill effects of areca nut. So that is where it becomes very important that we come out with small slots because now we are quite proactive in terms of, what are the health benefits which are available. We need to see that, these small 30 seconds awareness films will also go a long way, but they should come at prime time where our children are also going to watch this. So rather than, kind of in between coming through the films and all that, that is where when we talk of bus 2 minute for Maggie, so that is where we need to focus upon bus 1 minute suniye. Areca nut ki, when we talk of supari ki suniye, pan masala ki suniye. So that is where we need to kind of focus upon. But anything which is so much culturally acceptable, that becomes a real challenge. If somebody thinks that it helps you in digestion, old habits die hard. But we have overcome, a lot of issues through our successful immunization campaign. Day before I was at, I think last week I was at PGA Chandigarh, where we were talking about smallpox eradication stories, and subsequently about now we are post-COVID, we are talking about adult vaccination and all that, whether it is going to be acceptable or not. I said that earlier, when we started with rolling out the immunization program, every dadi nani said, Mera bacha to bahut healthy hai. So similarly, we have to work on that, we have to see what all cultural practices are prevalent in different states. And based on that only, we will say that, okay, now you see this picture. This person has been consuming, or through documentaries, this person was consuming this. If instead of this, you would have bought, some nutritious material, some food, something like, which is more, when we talk about, more protein based, materials and all that, that's going to be much more helpful. Like when we say that, tumko zindagi pyari hai, tumko, tobacco pyari. There's one ad, which talks about Akshay Kumar and all that. So similarly, we need to have catchy ads, which is going to talk about these issues. But the challenge is big, but the response is even, I'll say, more challenging, but at the same time more satisfying, because anything, basically we are talking, from the perspective of a common man, where they believe that basically, you know, even our Ayush practitioners or our Ayush people, or integrative medicine people, also they have different beliefs. So first of all, we have to do capacity building of our providers, because if we say that this is going to help in deworming and all that, or digestion and all that, this is all, kind of, I'll say that I don't want to use a harsh word, but I'll say that all these issues then need to be addressed. And that's why I said that we should be forming a strategy at the district level. Because what happens, even if we take an example of, Gautam Budh Nagar district, Noida, or if we talk about Lucknow, or we talk about Gorakhpur district, these districts are also very diverse in terms of not only, when we talk about areca nut or pan masala and all that. So every strategy has got to be, need-based, specific. And now, even you will not kind of imagine that basically even our religious gurus have started talking about, pan masalas and all that. So these strategies, along with, involvement of Panchayati Raj institutions, or when we talk about, resident welfare associations, or when we say that schools talk about Areca nut, so or that or health promoting schools, because we had done this thing with regard to discharging years where we made schools themselves responsible to be talking about. So when schools start talking about their own health, and particularly when we think about Areca nut or we talk about smokeless tobacco, these strategies are going to work rather than we talk about a strategy which people cannot relate to. So the small documentaries have to be made within the communities by the same, I'll say film producers should take the local participants so that people can relate to them. That is very important.
Absolutely, ma'am. You said it very rightly. Well, we do have a lot of comments and questions in the chat box. I'll move to that. I do have one last question. I'll ask Dr. Ravi Kaushik. Dr. Ravi Kaushik, in your viewpoint, what are the most important types of studies or research that are urgently needed considering the long-term public health effects of areca nut? What exactly do we need at this hour in India? The studies.
Again, yes, thank you for the question. We basically, I think as per my suggestion, we basically require multi-pronged approach in here also. We need to have some cohort studies to see the long-term impact. In fact, I was going through the questions in which one of the questions says that as per Ayurveda, the fresh areca nut is good for certain ailments, including halitosis and digestion problems. However, treated areca nut is the only one which is the problem. So we need to actually have good cohort studies to actually track the long-term impact of areca nut in all its forms and formats. And also to see whether the pre-malignant conditions which are being produced due to areca nut consumption, how much are they leading to cancer. We can also have some case control studies to see the prevalence of oral diseases with regards to the users and the non-users of the Ricolin or areca nut basically. So they would be the primary ones which would be setting a good data. We also need to see the behavioral research aspect of it to understand what are the drivers or what all are the things which lead to initiation of this problem, and also how people do differ in case they are there for cessation. So some of the people, they do cessation much better as compared to others. So what are the behavioral things, issues and other things which can help in deferring the initiation and improving the cessation part of it. As far as public health is concerned, we need to have implementational research also to see how the policies impact in the various states with respect to the bans which are there. And this collaborative projects we definitely need to do. Not a single one source study will do. We need to have more of collaborative projects from medical colleges, from WHO, international bodies, ICMR, AIMS, TGI included in it, to have this good evidence base. And very important, as I just mentioned, not just limiting to the cohort or case control studies, we need to have the behavioral research also going forward, because that is something which we have found in the smokeless tobacco as well as smoking studies. And there have been a lot of data which supports the methodologies, the different type of cessation strategies which will work more as compared to the others. So we need to have that aspect also into consideration. Thank you.
Thank you, Dr. Ravi. Indeed, behavioral research and implementation research is the need of the hour when it comes to identifying problems in Areca nut use. Well, I would now like to move on to the comments and questions which are there in the chat box. Dr. Sriram first has commented. He's there online as well. Well, areca nut use without tobacco is highly prevalent in many parts of India, but goes unreported in national surveys like GATS. What strategies do you recommend to ensure that areca nut use without tobacco is appropriately captured in surveillance systems, and how can we strengthen policy responses to its associated health risks?
Yeah, that's what I think I'd earlier mentioned also that, in the larger surveys, somewhere the whole issue of areca nut gets lost. But when we are talking about community behavior assessment checklist, which every ASHA is supposed to fill with regard to non-communicable diseases, and out of which also includes cancers also. So that is where they will be able to capture data with regard to areca nut specifically. And also from a program perspective, also we are also talking about system strengthening also. And that is where our National Tobacco Control Program, when it talks about system strengthening. So at the systems level, that means when we are talking about, non-communicable diseases clinic is already there in our, right from PHC onwards, there are specific days. So at PHC level, medical officer is seeing, but at CHC level, we have presence of community health center level, we have presence of specialists also. So that's where when we are eliciting about, NCDs and also that data becomes very, very important part. So I feel that there has got to be no one method. And as I said, that being a public health person, I realize that there is lot of, role of qualitative studies to elicit that. That means you go to the community, have some FGDs with the key informants and all. Key informants means they are the key to the community. We can unlock the information. Can be, Panchayati Raj member or Sarpanch, can be a ASHA worker, can be a, pharmacist who is having a shop and all that, can be even a vendor of, I'll say that the tobacco vendor who can just, or in the shop, they can definitely, kind of unopen the key and say that this is the burden of the problem. First of all, we have to make them understand that this is an important problem which is being, kind of is of public health interest. And so we need to look at, but we need to launch very, very focused and structured surveys which are representative of the population as well. So that means not only qualitative data, but quantitative has to comprehend this, or complement this whole thing. So together, if we have, good research projects which are not only talking about the burden of the disease, but at the same time, we are able to intervene. That means need-based intervention. Why do people take, which is going to be based upon, the information, what we elicit through qualitative data, that will be very helpful. So I feel that we need to again unearth or dig out the whole problem of the areca nut use in particular. We only just brush the issue aside and we don't talk about areca nut. So that is where it is important. And here, as I said, I'd like to make a mention of when we are talking of our ESTA project addressing smokeless tobacco in Asia. This was, I think, and this was a study which was centered to school children, which were of 6th, 7th, 8th class, So we realized that how much is the burden of the problem. But at the same time, still it was talking about smokeless tobacco products as a whole. So we kind of, need to look at the specific products which are prevalent in an area. And especially when we talk about areca nut, this is a very major issue of public health importance, and we need to talk, like today we are having a panel discussion. And so we must be talking about. So very good question, Dr. Sriram, and I'm happy you asked for this question.
Well, Dr. Sriram has some additional issues to ask about that. Well, I request Dr. Sriram, you can open up your mic and speak directly.
Good evening, ma'am. Good evening, all. Thank you for such a wonderful session because these things are not much discussed. Am I audible?
Yeah, you have to be a little
Yeah,
bit
so these things
louder.
are,
Yes.
yes, ma'am. Because even as a myself as a public health specialist, I also struggle to communicate these things at the field level. So often I've seen in the CBAC forms, we have seen, madam, this question,
Can't
but
hear you
that is
after
not
that.
segregated like, the Areca natives. Maybe,
Yeah,
okay.
when we talk about, the things
Can you hear me now?
whole. Dr. Ravi, will you like to answer this question? Because I feel that when we are, talking, we just pass it. Smokeless tobacco hai, isme kheni hai, gutka hai, ye hai, all these products, pan masala hai. So, this issue gets passed unless we talk of areca nut specifically. So that's where I feel that per se the side effects of areca nut are being unearthed or being, kind of now visible more and more. They were visible earlier also. But we never took this as a specific issue. When we were doing a lot of surveys on tobacco and all that, and right from the time when Codpa Act came into picture, we did not focus, we talked of tobacco as a whole. And our problem was, smoke tobacco, then came smokeless tobacco together and all that. Then we had different sections under, Codpa and all that. But somewhere, we failed to talk about, the specific issues. So, like we talked very specifically about electronic cigarettes and all that, but I feel like that, though that is also still become a challenge for the vendors, we need to talk about areca nut in particular. And as you said, that being a public health person, it's challenging also. Unless we, kind of see that this is the burden and this is where, and we have to take live examples. That is also, Dr. Shram, very, very important. And for that, what strategy is going to work for one community definitely can be applicable, but we have to structure it to that or tailor make it to that community. Dr. Ravi, will you like to answer something, add something with regard to this?
Actually, Dr. Shriram was saying something. Let him just complete. Dr. Shriram, are you still there?
Yes, sir. Actually, I just wanted to know because my network may be a little poor. Am I audible?
Yes, you are.
Yeah.
You are. Please go ahead.
Okay. So, no, I was telling, ma'am suggested, I understood, I accept it. Actually, in the CBAC and basic collection platform. So in that also that question has it together. I think Dr. Ravi sir has answered that. Actually, he told that is not segregated. Maybe we should have a segregated question for Aricanet, and then that will solve the purpose. And one more thing I would like to ask is, ma'am, do we have any surveillance system that is existing in the national level or in the state level dental colleges for this precancerous lesions or all these oral lesions, especially leukoplakia and the other lesions related to arecanut or chewing these
Definitely, you see,
substances?
that is how we get this information of, but we get them in form of morbidity. We do not have, like we have ICD-11 classification where we code the disease. So it is not we are talking about how many people are taking a recurrent and all. That will come out of our surveys. But if the person is suffering from submucous fibrosis or as a result of some complication of a recurrent, that we'll be finding in our health management information system unless we tune it to the other thing. Like when we have got, with regard to vaccines and all, we have got information about hesitancy and all. But that also is not very, we just know that there is hesitancy and we document it very broadly. But we need to have a specific HMI system with regard to, we do have with regard to, effects of tobacco, smoked or smokeless. So, but we are coding the disease that is there. And from there we get and we presume that this is due to, tobacco. That part is important because we do have cause and effect relationship also.
Uh, yes, ma'am. But that is also again, it is not very clearly explaining the purpose. I mean,
No,
like
but that's
arecanut.
where
Add on
that's where Dr. Shriram role of youngsters like you is there, that we make our education so much competency based so that a young, whether he's a medical or non-medical graduate is able to appreciate that, right? Because that is where we can start working from the local strategies which are competency based, and so that he can go to that. But definitely, we talked about case control studies and all that. But that data is somewhere, we do have historical studies also, smoking and lung cancer and all that. But we need to have areca nut and the side effects. People who are consuming areca nut and what are the oral effects or what are the carcinogenic effects and all that. So those studies also need to feature now. That is there.
Thank you.
Let me add on to Dr. Sriram's question. I don't know if I am explaining it right. Maybe my response would help you. Well, our GAT survey does contains questions on areca nut, betel quid with tobacco, betel quid without tobacco, pan with tobacco, pan without tobacco, snuff, water pipe, e-cigarettes, any commercial or non-commercial, even raw tobacco or raw pan without tobacco, without the condiments and spices. So any tobacco related, commercial, non-commercial, raw preparation, everything is included. GATS 2 is a very detailed, prepared in a very detailed format. GATS 1 was not that comprehensive, but GATS 2 has been prepared with very detailed consistency. So I hope that
Yeah, very right, Dr. Shekhar. But what important is you really pointed out in depth. But the important part is how we make use of this survey in that particular setting. Because when we break the data, we have to apply that okay, from the GAT survey, this is what emerged. And with the Recanut, these many people were there without, because our teaching only talks about as a whole, these many people are consuming. So I feel that this is a very good response you gave, and that has to be broken down and sliced to the state specific place. And we do have now, government is talking about quantity and quality of medical education, which includes paramedical education also. So that's what I was talking, that it has got to be skill based information and education with regard to locally available data, and which you said that these surveys are there. But I hope that more and more, small level surveys are there so that people can relate to that. That is there.
Great. So there's one more comment from Tejaswini. According to Ayurvedic medicine, fresh chewing areca nut is good for deworming, digestion, halitosis. Only cured areca nut is dangerous. Ma'am, can you throw some light on this? Ma'am, I think you have already.
Will you like to take it?
Yeah,
Yeah.
Yes.
I would like
Yeah.
Dr. Ravi Kaushik to answer that.
Actually, when we talk of areca nut, the active entity in areca nut is arecolin. Arecolin is actually working on muscarinic acetylcholine receptors. When we talk of acetylcholine, there are two type of receptors which are there: muscarinic and nicotinic receptors. So arecolin primarily acts on muscarinic acetylcholine receptors, which is going to increase the parasympathetic nervous system activation, which is going to lead to salivation, increased sweating, increased digestive juices. So because of this increased salivation, increased digestive juices, it is perceived, and it has been perceived by since ages, that it improves halitosis, that means bed breath. So it helps in combating the bed breath. It helps in digestive activity. Partially, yes, because of increased salivation, increased digestive juices activity. However, as far as I know and I have researched, the areca nut, there are some carcinogenic components in areca nut, whether it is processed or unprocessed, which ultimately is going to lead to the pre-malignant and malignant lesions. So I am not sure whether such a thing actually happens, that the untreated or fresh areca nut is actually only good. Undoubtedly, there are some effects which can be good, which can be considered as good for us. But the bad effect, that point I don't agree with. As I just commented on the last comment as well, we need to have further studies to just ensure that these are, whether they are there or not.
Are you finished, Dr. Ravi Kaushik?
Yes, please.
All right. I was actually typing the additional response to this. Actually, these substances, tobacco and areca nut, they are both sympathomimetic substances. They basically increase the sympathetic activity in our body. So all the excretions are increased when they are consumed, be it
Uh,
salivation,
they,
be
they
it
they
the
primarily increases parasympathetic more actually. They act on
yeah.
acetylcholine receptors, which increases the parasympathetic activity. So
Okay,
therefore,
okay,
the
okay.
salivation is
They increase the
increased,
heart rate, they
digestive
increase the
activity
blood
is
pressure,
increased.
they increase the gastric activity, they increase everything. So that is
Yes, yes,
why
yes.
some people.
Nicotine, however, has more effect on the central nervous system. So it increases alertness and focus a little more.
Hmm.
So it has more of relaxing anxiolytic activities, properties, as compared to arecolin. Arecolin has more activity with respect to the digestive juices and gastric, salivation. And
Okay.
nicotine has more on the CNS. That is the difference. Both are mainly parasympathetic.
Yeah, sorry, parasympathetic. So they increase all secretions. So initially, might be,
Yes.
in primitive times, Ayurveda would have regarded that this as something beneficial to the body, but overall, as time proceeds and science recognizes new facts, we now know that it is causing more harm than benefit. Okay, so there's another question. Maybe we can take it as a last question by Kirti. Her query is regarding loosely marketed areca nut, and this more harmful as it has zero regulation in terms of its formulation, etc. Also, in many areas, it is mixed with katha and chuna, etc. So it is linked with oral cancer than alone areca nut.
Definitely, I think loose marketing will make it, even we cannot even have access to the data, but and if you go on, adding it with lime, katha and all, it makes it more, kind of, I'll say irritable product, and it becomes more carcinogenic also. And people keep on holding it in their mouth for hours together. So that's where I feel that any kind of loosely marketing must have a regulation. So that part is there. And plus, here our National Tobacco Control Program has got a very important role to play, because we must have mandatory, warning messages, I'll say, that loosely form this is available, which is dangerous also. And along with that, we must have child targeted messages also. This is there along with when we talk of labeling of the products and all that. Sometimes labeling also people do not read. I've seen that when we talk of 80% pack warning and all that, how many people we have seen dropping the cigarette box or box of smokeless tobacco masala or packet, even if warning may be any big, unless it comes through skill-based education, it is very, very important. And we must integrate this part into our primary healthcare strategies and into our messages, so that behavior change takes place at that level. Another thing is that India is, as I said again, big, diverse, but and we do have a rural health mission, we do have an urban health mission also. So it must be a talking point at all levels, but also our private sector, where so much of, I think almost about 60%, more than 60% people are going and seeking care over there. So it is very important that we display our messages there and we explain to them, like government is now involved, fully committed to TB control. Similarly, now private practitioners are involved. We do not want to reach the stage where the cancer burden also becomes so huge that basically, then we have to take the burden away from the private sector, because we need to have standard operating procedures for that. So it is very important that there is some regulation done. Thank you.
All right. Thank you, ma'am, for this beautiful response. I hope this answers everybody's question now. And yes, we have had some great thought-provoking discussions today in this session. The time is almost up. Well, rather we are 4 minutes ahead. Well, we have had discussions about what is the prevalence, what is the burden, what is the youth response, what are the market tactics, what is the scientific impact of public health impact of areca nut. So all these things we have discussed, and we will discuss a lot more things further. The next session probably is on the health effects, primarily targeting what exactly areca nut does to the body. So we are going to have it in the next session. So I would like to say a big thank you to Professor Sunil Agar ma'am and Dr. Ravi Kaushik for taking out their time and speaking on this very, very important yet overlooked topic. Thank you so much for your beautiful insights. And I would now like to hand over the session to Bhavya for giving her some final remarks.
Thank you, Dr. Shekhar. As we come to the close of today's enlightening panel discussion, I would like to express my sincere gratitude to our distinguished panelists, Dr. Sunila Garg and Dr. Ravi Kaushik, for their insightful contributions on the important and often overlooked issue of areca nut use in India. Your expertise and perspectives have helped us better understand the many layers of this topic, from cultural normalization of areca nut consumption to the serious health risk it poses, particularly in terms of oral and systemic diseases. Today's discussion has made it abundantly clear that while areca nut may be deeply woven into our social fabric, its harmful health consequences cannot and should not be ignored. Thank you once again to our panelists for sharing your time and knowledge, and to all of you for joining us in this vital dialogue. Let's continue to collaborate, raise awareness, and advocate for effective strategies to reduce the health burden caused by areca nut use in India. Together, we can make a meaningful progress towards healthier communities. Thank you and have a wonderful day.
Thank you, ma'am. Thank you, Dr. Ravi. Thank you, dear participants.
Thank you.
Okay. Thank you. So we are going to end the session now. Bye-bye.
Bye.